family. It's time for Winedown with your host, Missy, and the Winedown Wednesday crew. Join us tonight as we discuss topics that affect families on a daily basis. So grab your glass, your cup, or even your blanket. Settle in on the couch and join us in the room as we go live in 5, 4, 3, 2, 1.
Hola, family, and welcome to Winedown Wednesday. We are live and back in the room again for this session. Again, we are doing 3-week sessions going forward, and then take a 3-week break. So we are glad that you are joining us tonight in the room. As always, we start off with there is no hate speech here. We can agree to disagree gracefully. And just because something works in your house, it might not work in our house. And everything that we say here is suggestions only. We are not doctors, nor do we play one on TV. So we are giving you things from the mom perspective. If some of our moms have professional roles, then they will speak to you from their profession. But for the most part, we are coming to you from moms and dads that are just trying to figure out this journey of parenthood. So welcome again to the room. I am Missy. Melissa technically, but I go by Missy, and I am a doula. I'm the owner of Hands of Melody Doula Services, and we try to provide family to our families as they are going through this parenting journey. Joining me tonight in the room, we have special guests, and I will introduce them in just a minute. But normally joining us in the room and back for another season, we have Nick. Nick is our new mom liaison, and she works with our single mom. We have Rachel, who is a mom and head of our HR. We have Sheen. Sheen also works in HR. She's a mom. Angie is all things magical unicorn. If you name it and you can see it, print it, make it. That is Angie's job. She also is responsible for what you see live on Facebook and what you see posted about Hands of Melody. I see a few other mommies that are in the background. Shayla just came in, and then Shelly is our IBCLC. Shayla's all things communication and scheduling. So if you would like to get in contact with us for any reason, if you go to our website, www.handsofmelody.com, our admin team and our doula team are listed there. So that is us. We have some other mommies that are listening in the background. If you have questions during this chat or during this conversation, please drop them in. The ladies are monitoring the comments, and we'll get those questions to us because it's kind of hard to read those as we go along. So I'm going to introduce our guests. They are family to us, but guests for our talk show tonight. I had them send me bios. Okay, so it's been a long day. So if I jack this up, y'all just bear with a sister, okay? So I'm gonna read it, and they can correct me if I say anything wrong. So I'm going to start with Linford. So Dr. Linford Sutton is a board-certified pediatric dentist. Lord, do we need him, with a Bachelor of Science in Biomedical Sciences from the University of South Florida, followed by a Master of Science in Public Health and a Doctor of Dental Surgery from Meharry Medical College. I hope I'm saying that right. He further honed his skills through specialized training in pediatric dentistry at Howard University. So he's been in school a long time, y'all, more than my brain can process on this wonderful night. Dr. Linford loves working with children of all ages, including those with special needs, and enjoys helping young patients feel at ease in the dental chair. Known for his friendly, approachable nature, he meets kids on their level, understands their unique needs, and makes dental visits fun. His dedication extends beyond the dental care. As a father, he understands the importance of supporting parents and in caring for their children's oral health. He's also an active member of the American Academy of Pediatric Dentistry and the American Dental Association. Outside of the office, Dr. Linford is a sports enthusiast, movie buff, and community volunteer. He's also a big kid at heart, which helps him connect with young patients in meaningful ways. His joy and warmth make him a welcome addition to the team and a trusted partner in children's oral health and well-being. Did I do that one justice? We good? Okay. All right. So he been in school a long time. That's what I'm gonna say. That made my hair hurt just thinking about how much schooling y'all got in y'all's heads. And then Dr. Kia Everett is a compassionate and knowledgeable general dentist dedicated to empowering patients through education and exceptional care. A native of Northern Virginia, she earned her Doctor of Dental Surgery degree from Howard University College of Dentistry and holds a Bachelor of Science in Community Health with a concentration in pre-health studies from George Mason University. She also completed an advanced education in general dentistry residency in Bangor, Maine. Dr. Everett has practiced in various locations, including Laurel, Maryland, Greensboro, North Carolina, and now in Annapolis, Maryland. In her personal time, she enjoys traveling and spending time with family and friends. Yes, so they are a team, y'all, a husband and wife team, Black excellence. I love it. And a welcome addition to our community and our group. So we are honored to have them. Akia, welcome from North Carolina. Because listen, I didn't know until I read your bio that you have been in North Carolina. I was there for 21 years. Angie is from North Carolina. So yay, we bringing the South up north, trying to do what we do on this side of the moon. So welcome, guys. Thank you for being here. Welcome.
Thank you.
Yes, thank you for having us.
Yes, yeah. So forget the conversation you heard before we started the chat about the sugar and the syrup and act like we didn't have any of that conversation, because we're gonna act like we are not out here eating all the stuff we shouldn't eat and doing all the things that we should not be doing to our teeth. So we're gonna start doing better with our littles because they like sugar too. But it's yeah, so I'm not even gonna pretend like we not giving all of the stuff over here.
That's fine.
Yeah, our baby eats fruit snacks too. And I'm never an advocate for eat what you're gonna eat. Just take care of your teeth by brushing and flossing. So there's no judge it from us.
All right, well, I'm judging myself because the amount of sugar that probably come through this house is way too much. So we'll get into the conversation. I think I mentioned before, I did mention before the chat, we had a conversation a couple of years ago. I think most of us on here, I think Lucky is the youngest. And he's 2, Shelly, or 3? 3. I don't know. Y'all
He'll be 3 in March.
He'll be 3. Okay, and then we go all the way up to our oldest, Angie's 5-year-old. And so we had a conversation down the rabbit hole of them being toddlers about brushing teeth, whether electric toothbrushes were okay because somebody read that you shouldn't start with an electric toothbrush, and then those ones that go back and forth came out. Does any of that really matter, or just us brushing them?
So I guess I'll take that because that's my area. So I'll say as far as the electric toothbrushes, it really depends on if your kid can tolerate it. A lot of times kids don't know the amount of pressure that they're putting on those teeth. So if they're pushing too hard, because a lot of, like, if you have like the Oral-Bs and the Colgates that are for adults, they usually, if you press too hard, they have a light indicator. So it kind of turns red when you push too hard. But the kids' brushes, they don't. So they don't know how hard they're brushing. So sometimes it can be detrimental to the kids' teeth if they are pushing too hard. Now that's where the parents kind of come in. So as parents, when you're brushing their teeth, you kind of want to put them in the mirror so one, they can see what's happening. Because a lot of times if you're just going to hold them down and brush them, it's kind of like it sets in a little panic and fear because they can't see what's happening. So most kids are observational learners. So if you put them in the mirror and then also come from behind them and let them hold the toothbrush and also hold their hand. So you kind of guide them and start building that muscle memory so they can start learning, the ways to brush teeth. Because a lot of times we teach brushing just like this, but we don't teach them to turn their hand backwards and get the same side. So it goes often missed. So when it comes to regular toothbrushes, I would say start them on that so they get used to, the motion and building up that muscle memory and how to get all areas. And then once they go to the dentist a few times, they may use the rotary toothbrush on them. At that point, it may be okay to start introducing that at home.
See, I never thought about the pressure part. I don't think out of all of our research, we did not get, unless nobody just mentioned that they saw anything about the pressure. We did some of them don't like that sensation or whatever, but I didn't realize anything with the pressure. Rachel, your hand is up.
Yeah, what about I put in the chat the U-shaped ones because I've seen those and I was gonna invest in getting where you just put it in and the bristles just go and it gets the upper and lower teeth.
Yeah, see, I'll say this. So for very, very little ones, there are things called surround brushes that are because kids will bite down. So you kind of hold them on the side and go around the teeth. And so to get the bottom arch. But the thing is, as they bite down, because there's bristles on all three sides of the tooth at the time, they're helping you brush. But the ones that are just like the U shape, you're just going back and forth like this, or even the ones that vibrate, you got to think they might get the teeth, but they don't get the tongue. And the same bacteria sits on the tongue. They don't get the roof of the mouth. They don't get the cheeks or the gums. So a lot of times things go off to miss, and we still wonder why, they wake up in the morning and their breath smells like yesterday. So we got to make sure that we not only brush the teeth and the tongue, but also all the other surfaces. So while they may be convenient, it's not necessarily the best thing for the entire oral health. It might just keep the teeth clean.
And my concern is also having that product dry out over time, because when you use a toothbrush, you're having the bristles sit, for an extended amount of time and dries out. My concern would be water or what bacteria sitting in this U-shaped appliance and not completely drying out. And then we're using the same thing over and over and over.
Oh, just bust my bubble because I.
Is it too early to talk about the breath once they turn like 3?
So there's a couple things.
What is going on?
My question responding to like, hey, if they have bad breath, okay, a couple things. Are they snoring? If they're open mouth snoring, a lot of times those are signs and symptoms of obstructive sleep apnea. But also if they're open mouth snoring, all the bacteria and dust and things that are already in the air are hitting the back of the tonsils. So if the tonsils haven't been removed, all the bacteria is sitting in the back of the throat. Also, if they've been sick, the postnasal drippage and just all of the things draining in the back of their throat, that could also cause the breath, kind of bad breath in the morning. So it's not only like brushing the tongue, brushing the teeth, it's also, the total health. So all of the head and neck. So we're really looking at, sorry, she went to go get my daughter because she's calling. So we're really looking at like the total health of the child. So for me, I not only ask about the teeth, but I'll ask about, hey, how are they sleeping? Are they sleeping through the night? They usually teeth until about 2.5, 3 years old. So if they're not sleeping through the night, maybe it's because those teeth are coming in, or we may have some issues with the tonsils and the adenoids in the back of the nose that's causing constriction in the airway where they're not sleeping properly and they don't get really good quality of sleep. It may be beneficial to, if they are snoring, take a video and then let's consult an ENT. Wow. So consult the ENT or consult their pediatrician. They may put them on Flonase. They may put them on hey, we do need to do surgery, or have them do a sleep study to really confirm whether there's obstructive sleep apnea going on or not.
Okay. I see your hand.
Yeah, so I actually wanted to circle back to something you were saying in terms of like the brushing when Rachel asked about like the U-shaped thing. So you mentioned like the cheeks. So it's
hi, sweet face.
So it's also parents, we should also be brushing their cheeks. Yes, not so just like the tongue, a lot of times, and the roof of the mouth.
Right, and so
let's add in the roof of the mouth, that part too. But
right, the roof of the mouth, but also a lot of times, if you ever see your kid randomly start chewing, it's because there's food that's stuck all the way back in their cheeks, and they just all of a sudden start chewing. Then it's like, where'd you get the snack from? Because I didn't give you anything.
Yep.
So it's mostly like if we're not brushing in those areas where it goes often missed, and then that food sits right next to those teeth, and it can cause cavities right along the gum line if it's not only missed. And then again, the bacteria sits against the cheeks as well. So not only brushing the cheek, but over in like what we call the vestibule, or where like the deep areas next to the teeth, that's where we also want to brush as well.
When is too how do you brush the top of the roof of your mouth?
Toothbrush
demonstration. Okay, so can I see?
She knew y'all were going to need a model tonight.
She said, "Well, not even that. I'm just
a lot of
thinking
times,
of
if you
like
come from behind them, if you take this like one finger, like if you're left-handed, you take one finger here and one finger here, and just push. At that point, if you're inside the lip, that's perfectly fine. But you're actually holding them open, and then you just use the brush, just like you would brush the back of the teeth in the front. So it's just like an outward motion.
Yeah.
Like,
Okay. So,
did anybody mention
all the times I've been to the dentist? My dentist
never once mentioned it.
No, you're
once
supposed to brush everything. Cheeks, everything that's in the mouth is supposed to be brushed.
Oh,
Everything.
man.
So I think all these
Speaking
other
about
dentists
teeth,
need to go back to school or something, because no one ever mentioned that.
None, not a word.
Well, what about mouthwash?
Yeah,
So it's
that's
very
that's what my that's what Jack's dentist told me to do, because one, he can't gargle, right? He's just gonna swallow.
Yeah.
So he gave us some like the gauze that they give you like at the hospital.
Mm-hmm.
So I dipped that into his mouthwash and squeeze it out, and that's how I get his cheeks, the mouth, under his tongue. I get like behind, like between his lip and his teeth. I do all of that. Now I don't brush the roof of his mouth because I never thought to do that. But I do make sure that I take that mouthwash and I get all the areas.
Perfect. So I would say the gauze is great, but you can also use the toothbrush and do the same thing. Sometimes it's a texture thing. The gauze may be a little bit easier. But as far as the mouthwash, if they can't swish and spit, or if they're not spitting out the toothpaste, I wouldn't necessarily worry about using it. But if you do use a mouthwash, make sure it's the non-alcoholic mouthwash, because Listerine does have alcohol in it. There's brands called like TheraBreath that might be a little bit better. But those things, of course,
now I gotta see if it got alcohol.
They're spicy
and from I don't like seeing really adult alcohol-based mouthwashes or mouth rinses for adults either. I think people have become accustomed to if it burns, it's working.
If it burns.
But what it does to the tissue is it really dries it out over time. And if you're honestly, if you're doing a really good job brushing, flossing, I like tongue scrapers, you really don't need mouthwash. You really don't. And if you do want to use a mouth rinse, I prefer something that has either like a fluoride base to it to kind of help strengthen the teeth, but I really don't like Listerine and alcohol-based product because it's very drying unnecessarily to the tissues.
I don't know who recommended TheraBreath, but
I'm gonna blast my household. My husband swears by mouthwash, and he'll get up I don't know how many times a night, and because he just doesn't like that taste in his But then he's like, babe, my mouth is so dry. I never knew. He probably drying out his own mouth. Babe, I know you watching. So that part, you setting yourself up for failure. That part. Yeah. Oh wow. Okay.
So we can stop killing ourselves, because y'all know that the brown, the yellow Listerine, that one that
the one your grandma had. It's really unnecessary.
I that train years ago. No
ma'am. People really like that burn though.
Wow. I figured if it wasn't burning, it wasn't working.
see the point. Yeah, it's really unnecessary.
Okay, so we don't. At what age? So let me make sure. At what age should we start using fluoride products with our children?
So you can use fluoride as soon as you see the teeth. As long as it's a smear or a very rice grain amount of toothpaste, you can actually use fluoride. That's okay to swallow. Fluoride is kind of like Goldilocks and the Three Bears. Too little is too little, too much is too much. But if you just use enough, it works just like it's supposed to. So at that age, at very 6 months, the teeth will start coming in. Usually around 6 months, you'll see those bottom two teeth come in. And then at that point, you can still be using a finger brush. You don't necessarily have to use an actual brush. So you can still use the finger brush. It's perfectly fine. Now, as they get older, once they learn to spit, you'll move up to a pea-sized amount of toothpaste. But Crest Kids is perfectly fine. Crest Kids is perfectly fine. It has fluoride. Tom's is actually pretty good. That has a little bit less fluoride, but it still does the job. You do have some that don't have fluoride in it. I do see a lot of parents that don't use fluoride. That's perfectly fine. If you're drinking a lot of water, there's water in, it's I believe 0.07 parts per million water in fluoride in water, natural drinking water. So that's one way to kind of get it as well.
Okay. All right. So,
okay. What about flossing?
Go ahead. Yes.
If the teeth are touching, you have to be flossing. If we're flossing just at night, then that's perfectly fine. If you're flossing 3 nights a week, at least every other night, great. If you're doing it every night, that's even better. Those little flossers, that's perfectly fine too. You can, for little kids, you can use those up to 3 times and then you can throw them away. But if the teeth are really touching, yes, you want to be flossing, because it doesn't matter how much you brush, those cavities will come.
Right. So
Shayla, don't tell me you throw them out after every use, because your face just looks like
every
what?
use,
Oh, girl, no.
I do too.
No,
Absolutely. Because my brain is like, ooh, that went between your teeth and got food and plaque and buildup, and I'm not putting that back in your mouth. I cringe to even go like from like, ooh, you did 3 teeth.
Mm-hmm.
Oh gosh. Oh gosh. I can see the food. I don't want you putting that back in there.
Another way you can do it is take like some of their mouthwash, dip the floss in there, and then actually use the floss on a couple spots, and then dip it back in and use it again. So that actually will get the mouthwash underneath the gums, and that'll actually help with the gum health as well as the teeth.
Where y'all been our whole kids' life? Because we is just jacking it up over here. I feel the same way about this conversation like I did when we were talking to Dr. Wortham, and she was telling us that by 18 months, your kids should know all the letters and all the sounds that the letters make. I'm having that deja vu moment.
The next day, I started teaching my child.
Like I'm failing my
Say it backwards.
Okay. Listen, this is why we bring real doctors in and we don't play them, because we didn't go to school long enough.
So I guess the question that I have is like my son, when we brush his teeth, I would say 4 out of 10 times he spits out his toothpaste. Because when I do the front, he'll suck it, and I'm like, wait, there goes all the toothpaste, and then he swallows it because it has, flavor in or whatever. I'm like, Jay, you're not supposed to do. But the mouthwash, he'll swish and spit. But then when I'm brushing his teeth, it's like, here I gotta go add another toothpaste, and I'm like, don't spit. He's like, oh, sorry, I swallowed. Like, it's like a fun thing. And I'm like, I'm trying to keep you from.
Is it flavored?
Is there like a trick or something?
Flavored kind?
Yeah.
Is it fruity? That's probably why.
So that sometimes it's if it's a flavor thing, he just likes the flavor. Sometimes you have to break it down into increments with kids. So if it's like, look, we're gonna stay open for 10 seconds, we're gonna brush for 10 seconds, and in those 10 seconds, you get the entire top, and then he can spit, and then you can re-toothpaste, like just use half and half, re-toothpaste. Because with kids, we say brush 2 minutes. Realistically, if you get a solid 30 seconds with a toddler, you're fine.
Right.
If with a toddler, if like 4 or 5, if you get a solid 2 minutes, great. But as parents, I would say give ourselves grace as well, because some nights are hard. Some nights are hard. You got to fight with them. Some nights is very easy. But if you get all the teeth and you get just enough to say, look, I got every single surface I was supposed to get, go to bed.
That part. Okay. That part. So I have a question from Facebook. It says, what do you do when you have a child that barely opens their mouth? We've had issues after intubation from a procedure, and now it messes with their mouths.
So they've had a procedure recently, and then now they won't open because it feels very invasive. It was a traumatic experience.
Yes.
So you give some control and power back to that kid. So you let them hold the toothbrush. You let them kind of feel like they're dictating what's going on. But if they feel like they're in control, they can pull it away when they're ready, or they have some type of say in what's happening, then they're going to be more willing to accept it. Also, if again, break it down in increments. If you're counting, kids are perfect. If they know that there's an end to it, if they know that when I get to 10, we're going to stop. So I'm gonna go 1, 2, and even if you have to slow down the counting to feel like you're gonna get a little extra time, that's fine. It's a little trick. Sometimes you count real quick. All right, cool. We're gonna count quick this time. Then we're gonna count slow. So it might kind of help the situation in terms of giving a little bit power and control and comfortability back to that kid.
I like that answer. And I when I was reading your bio, I noticed that you also work with children with exceptionalities, which is really good, because I know that's a fight. I see the YouTube videos of children with exceptionalities when they're getting haircuts and things like that, but you never see like how a doctor works with them or how a dentist works with them, and that can be very anxiety inducing for the parent, just to the thought of taking them into somebody that may not understand their child or be able to work with their child where they are. So we definitely want to make sure we keep pushing your information out, because we do have children in our group that have exceptionalities, and so we want to make sure that we are not missing things with our children because of our anxieties to have to deal with it. Because we'll do that a lot of times with ourselves. Me, I have a fear of dentists. I ain't gonna lie. And it started from a super, super young age. Medication made my teeth weak and all of that kind of stuff. So it just set this pathway for me in my mind that dentists equal pain, even if it's just getting to the office. Like the last time we were there, my husband tell you, I was shaking so hard, the dentist was like, we're not going to do this. You probably need to be put to sleep, right? Because it was that bad. And I'm trying not to pass that on to my children. So we are making their dentist appointments. We are going in with this happy-go-lucky attitude, like making it a big thing. And I love that for them and trying to hold that fear back. But I do know things that cause us anxiety, we have a tendency not to, just like food things. If we don't like broccoli, we never feed our kids broccoli. You know what I'm saying? So I can understand people not wanting to bring their children to the dentist. One, if they've been traumatized by a dentist, or if they have a child that is going to have some kind of challenges in that area. So what would you say to a parent that has a child that falls into an exceptionalities group that is looking for a dentist? Maybe they're not able to get to you because they're not in your area. What do they look for in choosing a dentist?
So I would say typically a pediatric dentist, for those patients that have those exceptionalities. Pediatric dentists, when they go through their training, and I would say look for the pediatric dentist who's actually had the pediatric residency training, because there are some that, like kids and they really want to work kids, but they don't want to go, so they go to the residency program. Right. But in the residency program, you really get 2 years of solid training on how to address patients with all types of exceptionality, And so, like today, I saw a patient with Down syndrome. I saw a patient with autism and ADHD. So it's those patients, when you do see them, you have to know how to approach them and meet them where they are. You don't necessarily be like, okay, this is the dentist office. This is how we're going to do it. So, for example, we do have things that kind of help with them. Sometimes a hug is what patients with autism may like. So we do have things like a papoose board. To some kids, it may be traumatizing. To a patient with autism, it may be comforting. For our practice, we do have like movies and we have music. There's all types of, if they have a sensory toy with them, that's perfectly fine. Allowing them to hold something in their hand. I know there's some practices that have dogs that are comfort animals, emotional support animals. So that one's kind of rare to find because that's somewhat new. But the main thing is if they go to a pediatric dentist and they go early and often, then it becomes part of the routine. It's something that's not different, something that's not new. So, and then the main thing is if you make their appointments, please make them early in the morning. Yeah. Because when you make them early in the morning, a lot of times you get more cooperation in terms of behavior wise, and we're able to do a little bit more. Now, I will say if there's ever an incidence of where we have cavities, sometimes the changes in sensation and the numbing in the office will not work. And so pediatric dentists also have the option of the sedations. Some have credentials to go to a surgical center. And so they may put them to sleep. They'll take really good x-rays and they'll do all of the treatment in one shot. So that's an option as well. So I would say as parents, just kind of touch on the anxiety portion. Parents, I know a lot of times that's built through our experiences, but a lot of times if we allow them to go through certain things, and it doesn't have to be a bad experience. Right. It can also be a good experience. Right. And if they started a pediatric dentist early, when they get older, one, they may not even have a whole issue with cavities, or they may learn early, hey, this is not something I want. Right. So some things are a little bit of a lesson, but as dentists, we're just here to help.
Right. And I would say on a general dentistry aspect, I do see children, and some of the ones that are well behaved and have the best outcomes are the ones that who graduated out of the pediatric dental setting. Honestly, the ones that come in and will allow you to do whatever are the ones that have had that experience with the pediatric dentist. And honestly, as a child, like I would say, if we're wanting to be like, everyone's afraid of us. Like we have just come to realize that people are afraid of the dentist. And so I'm always an advocate of children being seen where they should be seen. Like, would you take your child to a pediatrician or a physician's office that didn't have toys or didn't seem fun and didn't have nice paint on the walls? Because once you get to our side, it's different. It's much different. It is not this fun, we try our best, but we are accustomed to people not liking us. And so I'm always an advocate for children being seen with a children's dentist. Not that we cannot, and I do see some children, but I do think it's important to kind of build that relationship earlier rather than letting the child come to the general dentist. And, I know people want the convenience of having the entire family seen in one place, but just like you have a physician for yourself, you should also have a physician for your child. And I do think it makes a major difference.
Yeah.
This is kind of timely for us because my son goes to the same dentist as me for the convenience, like exactly like you mentioned. And also, I think I had really low expectations. I was like, he's just gonna go get a cleaning and we'll do it so that he can get the exposure and not be anxious. I'm anxious. I get prescribed a Valium every time I go to the dentist, and they just know this because that's the way that I am. I let him go, and I was cringing more than he was. He was excited. Like you said, they did stickers and they tried to make it as fun as possible. But he fell a few months ago and busted his lip and needed stitches. And we just realized maybe a month ago now that he has a necrotic tooth. It's like slowly turning gray. And we realize it's probably because of this trauma. So he actually has an appointment in the morning tomorrow with a pediatric dentist. And so I'm really looking forward to that. Like my friend who recommended it, she was like, I really think you should go to a pediatric dentist for this. And if nothing else, we just want to like get x-rays and see whether or not it affect his permanent teeth. That we'll hope, because he's probably not going to lose that gray tooth for some time. But this is really timely. So I'm not as nervous as I was. I'm looking forward to tomorrow now.
Yeah, and they're gonna pull out the full stops because listen here, when you come to the general dentist, I got a sticker and and that's all I got.
And a toothbrush.
I got a sticker for you. And if you're not gonna be cooperative, I'm here, Mom. Here's my referral pad to the pediatric dentist who's going to take care of all of your needs. So, I really prefer that for children.
How old is Miles, Nick?
He just turned 4.
Okay, so I've seen, because I got a whole lot of kids, but my experience has been usually the order that they come in is a lot of times the order that they fall out.
Into where I was going.
Okay, so and if they come in super early, they usually lose them earlier. So mine tend to had gotten teeth a little bit later. At least my girls did. And then theirs fell out later. So they were like late 5, almost 6 before teeth started falling out. Whereas my son started losing them at like 4.5, but he got his really early. So is that something as parents that we can kind of prepare for? Like those bottom 2 came in, so they'll usually be snagging from the bottom. And then is that something we can look forward to?
So I'll say the timing is usually around 6 months. At 6 months, they'll see their first 2 teeth come in. 6 months, typically it's 4. So you see the 2 on the bottom, 2 on the top. And then after that, every 6 months, you'll see about 4 new teeth. So if you notice those 6-month sleep regressions, it's like, wait, they're starting to wake up in the night. It's probably because those teeth are coming in, because most teething happens at night. Also, if you see like low-grade fevers and diarrhea that can't be explained because you haven't fed them anything differently, it's probably because those teeth are coming in. It's the body's autoimmune response to what's happening. So then once we hit about 2.5, 3, and we have 10 at the top, 10 at the bottom, nothing happens until we're about 5.5 to 6. Around 6, the bottom teeth, the way they fall out, they start in the middle and they just go in order. The top teeth, usually. Hopefully no cavities or anything. They just like extract any in the out of order, but that's typically the normal order as long as the teeth stay healthy. The top teeth are a little bit different. It'll start with the 2 in the front, in the middle, and then it'll go to the next 2, but it'll skip the canines. And those are like one of the last ones to come out. So it's kind of odd at the top, but the main thing is as long as you keep the teeth nice and healthy, they'll fall out in the order they're supposed to. And they'll come in the order they're supposed to. Also, typically girls are first. So girls I always mess with the little girls. It's like, hey, so just let your brother know you're a little bit better and a little bit faster because your teeth are going to come in and come out sooner. So at the end of the day, it's sometimes dependent on the parents too. If the parents got their teeth early, the kids will usually get them early. If they got a little bit later, then that's what's happening. So whether it's delay or something coming earlier, it's not a problem. And then the teeth underneath, the permanent teeth won't come in until there's about 2/3 of the root developed underneath. So if we're waiting, it's because God's just taking his time. That's it.
I'm glad you said your follow-up response about girls, because I was getting ready to touch on a point. My girl she was 4.5 when she lost her first two at the bottom. And of course I went down a whole rabbit hole thinking, something was wrong, took her in, completely fine, teeth are healthy. The permanent ones came in right behind them. Of course they're coming in, and I know I'm gonna have a bill in a couple of years for some braces, but they're coming in and they're strong. But to that point, I know what I did when she lost her teeth, but I think it would be good if you could give tips on what we should do at home when once their tooth falls out, the proper care of the area and things like that. Because it's like one of those things, you don't know what you don't know. And I just never thought about the fact that, oh crap, her tooth is going to fall out. What do I do? How do I keep the area clean? Or what do I do in those days after the tooth or teeth fall out? So I don't know if you could touch on that to kind of help, because I know these ladies on here are going to come behind me here soon with their little ones' teeth coming out.
They not trying to sleep tonight.
So I would say the main thing is that taking like a Q-tip and a little bit of salt water and then cleaning the area of the gums and just kind of keeping them as clean as possible. If you see a little bump or a bubble on those gums, if it's not anything coming out of that bubble and it just kind of looks shiny, it's probably because the tooth is about to push through. Same thing with infants. Whenever it's like, okay, they got the 4 in the front, the top and the bottom, but why is there like a bump on their gum in the back? It's probably because that tooth is about to start coming in as well. So once you kind of notice that happening, the main thing is just keeping it clean. Brush the rest of the teeth around there as normal. If it looks like it's a hole, kids heal like Wolverine, so it's going to close out pretty soon. So it's the same thing as like when they fall and they bump themselves and like, look, you're all right. So it's like the same thing. So just continue to keep it as clean as possible.
I'm actually glad you mentioned that. So, you know how we say that, I think it was Melissa, was like the mouth is the quickest thing that heals, or something along those lines. Okay, so if your child falls and busts their lip and they have like that little knot like in their lip, is that normal, or is that supposed to kind of fade away at some point? Like I can't see it, but I can feel it.
You can feel like inside here. Bruise, yeah. So sometimes if there's like a little bruise or a bump here and it's like hard, sometimes kids tend to play with it. So especially if they're like biting on their lip, they can actually create what we call a traumatic ulcer, like a little fibrous tissue that is hard. And so at that point, that may just be there until we're old enough to see an oral surgeon. Like kids tend to try to play with it because it feels different. So it's the same thing when we do work on them, because their cheeks feel different. They tend to like bite. So you have to remind them, hey, don't bite your cheek. Don't play with it. And then just a quick note to kind of help the parents out there. I'm not sure if it's on like Androids, but I know on iPhones, there's an app called Tooth SOS. So if they hit their tooth, it has all instructions on there. Like if they hit their tooth, if they knock it out, if they break it, it has exactly.
Wait, what is it called again? Because I'm downloading
Tooth SOS.
Yeah. Shade out there about the iPhones. It's okay, because I'm an Android. I'm a BT Android. It's okay. You can still be a part of the group. I'm just saying that was like, they get on me all the time because I won't get an iPhone. But
so it looks like this little tooth with a broken tooth.
Oh, yes, and it'll tell you, kind of triage you on what to do.
I got
when you should seek care, when those type of
things.
That's
so cool.
Can I ask about grinding? My son grinds his teeth at night.
So typically, is it like every night?
He not with me every night, but maybe, because every night he's with me, he doesn't.
So I would say, has he ever seen an ENT?
Yeah, so he actually had his adenoids removed already. When he had tubes put in, the snoring got much better. I'm just not sure. And then also, I guess I can figure this out tomorrow when we go to the dentist, but with the necrotic tooth that he has, is it fragile? Like, should I worry about it chipping or anything like that? Like, should I brush it softly? I don't know.
No, just brush it, keep it treated just like normal. Because if it's not hurting him, it shouldn't hurt the parents.
Yeah, it doesn't hurt.
So if he's not
Okay.
complaining about eating, if it's not changing his eating and drinking, if it's not causing him to say like ouch or only chew in the back, then I would treat it just like normal. Because it's just like if they bump their knee and they start bleeding and you look at it, it's like, oh, you're bleeding, the kid's gonna react. So
Okay.
that tooth may just be gray until it falls out. And then
Okay.
as far as the grinding goes, grinding may also be a sign and symptom of obstructive sleep apnea in kids. So if he hasn't gotten a sleep test yet, I would get him a sleep test. Typically, kids that are like 4 or 5 or maybe a little too young for a mouth guard or a night guard. But the one thing you can do is if he's grinding, a lot of times check his positioning. So you may want to put your fingers on like the corners of his cheek and kind of lift his chin up. And so you're opening the airway and repositioning him. And that may actually help him breathe a little bit better and the grinding may stop.
Okay. Are there any like other factors if it's not that, if it's not his position, like just too much sugar or exciting things or being anxious, being stressed? Because I grind my teeth and sometimes I think it's like, it's more when I've had a super long day, or something like that. I think I clench my jaw more and grind my teeth more on those nights. So I also wonder if I didn't like maybe wind him down for bed properly and he's anxious. And then the reverse will happen is that now his positioning will be off or his teeth will be damaged because he does keep grinding them.
So a lot of times, like obstructive sleep apnea is hereditary as well. So I would.
Whoops, my bad.
If kids are grinding, if kids are grinding, it's not necessarily your fault. But if you have things that are going on with you, it may be anatomical in the way that his teeth are sitting, or if his tongue is like positioned to where he has a tongue tie, and his tongue. Because typically, if you look at infants or even kids when they're asleep, if you open their mouth, their tongue should be sitting at the roof of their mouth. If their tongue isn't sitting at the roof of their mouth, they may have a tongue tie that keeps them from having that tongue go to the roof of the mouth. And if they're laying on their backs and that tongue is tethered to the bottom, the muscles of the tongue will relax, and then they'll slip backwards. So the tongue will slip backwards and constrict that airway a little bit further. Okay. And then that may cause that constriction in the airway where we're not getting enough oxygen. So the oxygen demand for the body isn't being met. So the brain starts stressing out. And so if the brain is stressed out subconsciously, we're going to sit there and grind our teeth like this.
Well, that's the first time I've ever heard the tongue tie being linked to anything other than really rough breastfeeding journey or speech. Like nobody's ever said, hey, because a lot of people are opting now not to clip those tongue ties unless it's gonna affect their speech. But that is also something to consider. I think that is not being shared with new mommies when they come in and these little people have tongue ties, that it could also affect their sleep, if not now, eventually, because they're waking up every hour anyway to feed when they're tiny, but when they start sleeping longer, that could affect why they're not sleeping as long if they're having that issue like breathing and different things like that. So again, that's one of those things that I don't think anybody's telling moms, right? That's the first time. I don't know if anybody else has heard that. I know, like I said, Shelly's an IBCLC, so maybe she's heard it before. Yeah, but that's something that's not like people are just like, oh, well, if it's going to affect their speech, then I'll get it done. But if not, or if it's not really like hurting for breastfeeding, then I won't, I won't get it clipped. But it's also going to maybe affecting their sleep and their breathing at night and all of this. So again, it's just not a lot of information. Well, I say it's a lot of information being left out. I'll say that. So God, it's a lot of things to think about.
I think also as parents, I'm not trying to cut you off, but also as parents, it's a lot. It's a lot of information to take in. And so even during dental appointments, I know I probably got maybe 2 minutes of attention of that parent. So I may not touch on all of this in the first visit, or I may touch on like some of the high points. And then, some dental practices will give you like a report card. Like, hey, these are the major things we talked about today. So I would say, as parents, when you go into these dental appointments, make sure you take away like 3 or 4 things. It's going to be a flood of information, but if you take at least 3 or 4 things, we're doing our job.
Yeah, absolutely. So I know we see the pediatrician when the little people have a tongue tie. And a lot of times they will send you to like an ENT or whatever. Is that anything that if they're deciding not to get that done, that should be on like the list of things to talk to their dentist about, their pediatric dentist about, oh, they have a tongue tie. Is that going to affect their oral health later, other than the sleeping, maybe?
So I would definitely at least bring it up and have that conversation, especially with the pediatric dentist. Some pediatric dentists do frenectomies in their offices. Some will refer back to the ENT and send you with a referral like, hey, can you do a frenectomy and release this tongue? That sometimes needs to be coupled with a oral facial myofunctional therapist. So somebody to help strengthen the muscles of the tongue, because if you clip a tongue too early, and the tongue isn't strong enough to hold its own position, that tongue may actually cause more snoring issues later. So those therapists are basically, physical therapists for the mouth. And once they do their work, then especially when they're older and they understand like tongue positioning, being able to do those exercises like you ask and need them to do, then at that point, that's when it just really takes a team to kind of attack this whole issue.
Question in the chat: what's the best way to help decalcification because of severe milk allergy?
Oh, I was gonna say in my face, but that's milk based.
So I would say a lot of decalcification, especially when it comes to, well, it depends on how old the kid is too. So we can, do the fluoride, like 3-month fluoride treatments, and have them come in and get the fluoride varnish to continue to help reinforce the healthy tissues of the teeth. And then at that point, as long as those teeth stay healthy, they may still have those little white stains on them. The white stains are perfectly fine. They're more susceptible to cavities, so we definitely need to make sure we keep up the oral hygiene at home. But at the same time, sorry, she's calling us.
Listen, it's okay. It's okay.
So the thing is, as long as we're keeping up the oral hygiene at home, and we're not going to necessarily take away the white spots, there are things that you can do, like cosmetic treatments like Icon, that will actually like resin infiltration. So you'll try to take away some of the white spots. It may not completely take it away, but once we get older, you can still do the braces. You can still, as long as the teeth are nice and cavity free, you can still do the braces. And then once the bone is mature enough, we can do any cosmetic work that needs to be done after that.
Okay. And so I want to go back to just before the calcification question, and you were talking about if you clip a tongue too early, is there a good time frame? Because a lot of moms that are talking about the clipping and the tongue tie are told that like during their first few visits. So is there like an optimal time for a parent to think about it?
So with tongue ties, typically most of the time when they are clipped, if they're clipped really early, it's when those kids are having those latching issues. So when we've seen a lactation consultant, when we've seen, the pediatrician say, hey, like my baby's not gaining weight, they're not tracking well, or we have issues because we have issues latching. We're not having the letdown because we're not getting that nice suction. So when that happens, a lot of times that's when they'll say, okay, let's clip it. And then mom and dad will show you how to do the exercises.
Okay.
If we catch it early, great. Sometimes kids power through it. Like, look, we went to the bottle, it wasn't working, we didn't know. So now they're 2. What do you do? So they're 2. We're going to look at speech development. If we're looking for 20 to 25 words that don't have the lisps, that they're clear words that they can say around that time. If we're having issues with speech, then we may need to revisit that conversation. So it just kind of, it's dependent on the patient when they walk in and what the issue is when they're walking in. Sometimes, and I'll say this too, a lot of times schools, and no knock to any teachers, because I know you got 30, 40 kids in class sometimes, or 25 plus, and being able to make sure everybody stays on task. Sometimes you got that 1 or 2 that are running around, that are unfocused, that have those issues, they're very hyperactive. Sometimes that's related to obstructive sleep apnea too. But
Oh shoot.
In the sense of looking at their sleep. If they're not getting a good enough sleep, they're not getting that natural reset, that their brain needs. So instead of allowing them to say, let's test them for ADHD, let's look at the quality of their sleep. Because a lot of times they usually throw medicine at it to control the situation and not treat the actual problem.
Wow. Yeah, I mean, when you say it, it makes so much sense because after a 2-hour power nap, they ready to tear the whole house down, you know. So you would think if they get a full 10, 12 hours of sleep, they probably could function better. Wow. Yeah, that makes
if
so
they're
much
tired
sense.
during the day, if they're like yawning when they're first getting up and they're like, I still feel tired, they didn't get really restful sleep.
So, okay. So Kendra just put in, nobody showed them anything about exercise for her little one's tongue, and he just turned 2. And I know that, and I hope it's okay to share, Kendra, his speech is not like she wants it to be, or like, you know, I guess because you read the book, you should have this many words this way, right? So you can't go back if you feel like everything else is fine. This is a healthy, normal child. Everything is fine. But now that you say that it could be related to maybe a tongue clipping too early or not doing the exercises, is there anything now at 2 that can be done that they can work on to strengthen the tongue, you know, from this point going forward, that could probably help speech to even develop even more?
So there's the oral facial.
His tongue tie was clipped at like 2 weeks. He wasn't able to latch. The tie was like all the way to the very tip of his tongue. So it was one of those things where when the pediatrician looked at it, it wasn't even like, yeah, let's wait and see. So we went ahead and did it. But I will say the moms were a little right to give him some time because he just had a speech pop. But it's still one of those things where I kind of wonder, is he dragging certain words, or is the laziness that we sometimes say, are there some other exercises we can be doing with him?
So typically I'll defer to like the orofacial myofunctional therapist, and they have like a whole list of exercises that they do, but the main thing is repetition. And then I know we talk about screen time with kids, but I will say things like Miss Rachel, where she zooms in on the mouth, and when she's actually talking, and the kids like repeat it back, or they try to you'll see them try to really articulate in the same way. So the main thing is I would consult the orofacial myofunctional therapist or speech therapist. Sometimes they're one and the same. And then I would really find out, okay, where are we having those struggles? Because they may talk to him now. Granted, how old is he?
He literally just turned 2.
So he just turned 2. So early. I would be a little patient with him. If he just turned 2, he's fine. Okay. I would just be patient with him. It's going to develop over time. And then especially if he's around other kids, you'll see it. He'll kind of pick up a lot faster.
Is he home with mama?
He has a nanny right now, but as everyone in this area knows, wait lists are crazy right now for daycare. So I would say play dates are great. Parks are great. When kids start interacting with each other, you notice they kind of bounce off each other and they're all sponges. So I think the one thing with our daughter, I'll say we never really did like baby talk with her. We just talked to her. And the main thing is once we talked to her, she picked things up between yes, we give her screen time. It's perfectly fine. Was it ABC Mouse? There's like a couple of ABC Mouse, Lingo Kids,
Moose Math. She's around other children.
She's been in daycare since she was like 5 months. So she's been around other kids, and something she says, I'm just like, where'd you learn that?
Yeah.
And that's what I realized after
the good and the bad of it. So it's like, where did you learn that? The good and the bad. So so
you don't know that. And maybe that's one of the things that we should tell people. Like we started telling people, like, while you're pregnant, start looking for a daycare, even if you don't think you'll need a daycare. Absolutely. And then the fact of the earlier you put them in daycare, the more they learn and start engage. Because, kids copy what other kids do, and it makes them more extroverted, if that's the word. At least I think so. But I didn't realize that until it actually started happening, and you're like, oh, that's different, So, yeah.
The good, the bad, and the ugly, like
Yeah.
I have one question. So it's my child got more specialists than I have. And I'm realizing that then there's pediatric specialist for things. So when we talk about him having a sleep study, is there a pediatric version of that? Should I be looking for a caregiver who does sleep studies for children? What does that look like?
So they have regular ENTs and they have pediatric ENTs. I would say typically the pediatrician knows who they refer to. And
so if he has an ENT, they can do the sleep study?
They can be able to do the sleep study.
Oh, okay.
Yeah.
So, and some sleep studies are getting more advanced where you can do them at home.
Yeah.
If you can find somebody that can help you do that at home, or let him do it at home, because when he's in a weird environment, his sleep is gonna be off anyways. So it may be like a false positive. If he's able to sleep at home, he's gonna get better results because he's in an environment he's comfortable at. So you can really look at the quality of sleep that he's getting.
Okay. Thank you.
That part. So, okay. I don't know about y'all, but I wrote so much stuff down from this one conversation. Again, it's like a repeat of that one conversation we had where you just don't know what you don't know. And wow, it's just a lot. So our takeaways are there are pediatric folk that can do stuff. So if we don't have pediatric people looking at our children, it's probably better to do so. They're gonna get more than a sticker, like Akia said.
And I do have some fellow doctors who love, like, I love children, but there becomes a point in time where I'm like, no, you must go be seen by a pediatric dentist. And I think it's best.
Yeah, it is. I like the fact that when they lay in the chair, there's the TV up here and they get the special glasses and they, all of that stuff, and it's very distracting. So I like that. I am guilty of having one family practice doctor for all of us because one, we live in the country and it's right up the street as opposed to everything being 30 minutes away. But we have talked about that, like, maybe we should probably just switch to a pediatrician and take that drive, right? Because there are certain things that you're just not going to get with a family practitioner for everybody or someone that's just general medicine, like you said. So that is a takeaway for all of us. And when the preacher says something, you say ouch and you do better. That's what we were told. So we appreciate all of you for all that you have shared with us tonight. It's been a lot. I can't say that we're not going to try to have y'all back because I feel like it was a lot more stuff that we could learn, and we barely got to you again.
Pregnancy and dental care, because I was ready.
Yeah, So listen, we're gonna talk about that offline because we need that. We need that part. Yeah, because we are onboarding loads and loads of new moms that are still pregnant, and so that is a thing. And they tell you not to take anything, hardly not even a Tylenol when you're pregnant. So what do you do when you got a toothache and the whole left side and the right side of your face hurt, right? What do you do? So yeah, I'm gonna text you tomorrow because I need you to come back and talk about that part. I think we've been wanting to ask all these questions about the little people too. So, and then we didn't even get into breastfeeding and yeah, so we're gonna talk offline. I'm glad I know you. And I've got bring her back flashing at me in the comments. So we definitely want to have you guys back. It is 9:58. So we're getting ready to say good night. Thank you so much for all of your insight tonight. This has been tremendously useful. And then half of our staff is out sick with stuff and other stuff. And the person that was going to ask you 1,000 questions was sick tonight, so we definitely gotta have you back because she was ready. So if she's watching, feel better, Mama. We hope that you get over all of this stuff. And to everybody that's been sick, and these littles that have been sick, from the to RSV, to COVID, to strep and flu, to then the ear infection on top of what, and then the pneumonia, like it's real in these streets. So please, please, please get your little people checked. Get yourself checked if you don't feel well. Don't go to work if you don't feel well. Don't send your little people to school or daycare. If they don't give Tylenol and Motrin. This is just my soapbox as a former teacher. Don't give Tylenol and Motrin thinking it's going to keep the fever down so they can go to school and you can go work half a day because we're going to call you half a day until you come get your little person. But now everybody in the class is sick.
The dope and drop?
Yeah, the dope and drop. Don't do it because now everybody's sick and then they got to go home, some to their pregnant moms, right? To their immune compromised siblings or parents, to all of the things, right? Stay home. It's just so beneficial if you stay home for 48, 72 hours. Give your body grace. Give your little person grace. They already going to be sleep in school. They already need your snuggles, even though you got to wear a mask because they right here. Like all of that. They don't care. Snuggle on them. Even if they're not babies, your bodies heal their bodies heal your body. So they need to be close to you, to love on you. If you got that breast milk we told you to store in the freezer and mark sick milk, drop that into a smoothie, give it to them. All of that kind of stuff because it still works. We love you all as a community. We are here to help. If you need us, all of our contact information is going to be in the outro in just a second. We're going to say goodnight and thank you again to all of those that have joined us in the room. So we're going to go camera off and on silent, and we will talk to our viewing audience next week, and we'll say goodnight to everyone else in just a minute. That is definitely not what I was trying to do. Google is jacking me up tonight, y'all. Be patient. Be patient. My computer wants to restart. Y'all give me 30 seconds and we're going to get it to do what it's supposed to do. No, you cannot shut down. There we go. We are out. My whole computer tried to restart itself, and that was the devil. I guess it said you have done enough.
Stop recording.
I did. It didn't stop. Oh, it didn't stop.